Getting a little bit long in the tooth. We remember the days when cell phones were about as big, about that big. Then they became a little smaller, and now we have the iPhone, and they'll continue to evolve. Well, the state of the art when it comes to dentures are no more, I'm telling you, thanks to Freedom Mini Dental Implants. Now, they still exist, but you're going to prefer this method a lot more. With me now is Dr. Reagan Ackerman with Freedom Mini Dental Implants. Welcome back, Dr. Ackerman.
Thank you. Thanks for having me.
All right. Is that fair to say? I mean, yes, dentures still exist, but for those who are unaware of mini dental implants, they're going to love the news, right?
Yes, 100%. And I love your comparison because the mini dental implant it's a smaller version of the surgical implant. It's just a small diameter implant. So it's a lot less invasive. I don't have to have as much bone to place implants to either get you out of your denture or even just get you out of denture glue and a floppy denture, and for people that can't wear their denture. So the mini implants, definitely people may have been told they weren't even a candidate for surgical implants, or maybe they couldn't afford surgical implants. The mini dental implants is definitely an option. It's been around for 10 plus years, but just kind of becoming just like everything, cell phones and things, but it's a smaller version, less invasive, less costly, less healing time than the surgical implants.
Yeah, let's make sure we emphasize this, because I think this is important. You say you need less bone.
Correct.
And it's less invasive. They don't put you under. It's really so much more of an easy process, less pain for you, but something else less for you, less money for you. That's right. It is less costly. That is good news. Everyone has a budget. We talked about inflation with Marcus. So before we take a look at this week's patient, I love showing before and after pictures. It's fun.
Yep.
Okay, let's show them a little bit about one of your methods, if you would, please.
Okay, I'll just start with the snap-in denture, because that is kind of one of the more common things we do. So many people struggle with their dentures. You're constantly applying denture glue, or especially that lower denture, it just flops and it moves and you can't keep it in. So with the snap-in denture, I'm able to place these little studs you see are the mini implant. And when I place these, just like he said, I don't put you to sleep. I'm not doing any incisions or stitches. I get you numb, just a little Novocaine, and then, we'll show the model later, just make a little pilot hole, and then this is a little titanium screw. It'll kind of screw and torque down. And the great thing about the mini implant, the same day I put those implants in, I can put these attachments inside your denture, and you leave that same day with the denture now snapped on to those implants, so you don't have to use gobs of denture glue anymore. You don't have to worry about it flopping around.
Very tight.
Very tight. It's a lot more stable. You wear this denture 24/7. You can snap it out, rinse and clean it, and then snap it right back in. So this is way better than a regular denture, and a good step up. And I know, and we have an option where we get rid of the denture completely, and we'll get to that option. But even with the snap-in denture, a lot of times too, you can see this is for the upper, where we can kind of remove some of that off the roof of your mouth, so you can taste your food again, and it's not gagging you anymore, which is huge for people.
Yep, and I'm eager to show the other method that you refer to, and we will a little bit later in the show. It's just teeth. That's all it is. There's no plastic whatsoever. It's like having your third set of teeth. So, Dr. Ackerman, today, I always like this because you'll see the difference, not only, in their smile, but you'll almost see the confidence exude from patients. I'm just predicting. I haven't seen these pictures yet.
Yep.
So this is Sean, right?
Yes, this is Sean.
Okay, here we go, Sean.
So there's before, was missing some teeth. His teeth were just failing on him. And so many people, they spend hours in the dental chair, and they're trying to do the right thing, and they get their fillings and their but just some people, you just lose your teeth, and it's not your fault. And that's kind of what was happening to Sean. He was losing teeth. He was trying. He knew that he was going to have all his top teeth removed, and he did not want to be in a regular denture. So we did the permanent teeth for him.
Look how much younger.
Yeah.
Yes.
So, and went very natural with color and everything. So I think it looks great. So he has the permanent teeth, which we'll show, but they're, porcelain, much stronger than a denture, nicer material. He has nothing on the roof of his mouth. He doesn't have to take anything in and out. He can taste his food. So it's kind of like the closest thing to having your natural teeth back. So he's just, brushing those with toothpaste, toothbrush, and using using a water pick daily.
Yeah, I like the natural look, but if someone were to opt for, you know, white, I mean optic white,
yes,
they can do that,
they
right?
can do that, yes.
Okay.
And that's part of, you know, our communication, and we have an array of shades, and, you know, me listening to your wants and needs and making that happen for you.
Now, just because I think the timing is right, usually we wait until we show you, you know, the second method here, but because Sean had that,
certainly.
Do you mind showing that? I think this is cool.
Certainly.
And you said third set of teeth. Okay, baby teeth, permanent teeth, and these are as close as you're going to get.
Exactly. So same process as far as placing the implants. We're just going to place more implants for more stabilization since we're cementing these, but no incisions, no stitches. I don't have to put you to sleep.
So that's just your gums.
This is just just your gums. I don't have to take you off blood thinners, anything like that. So I'll place the implants, and then we're able to make a bridge of teeth. So way less bulky than a denture, and it's porcelain with a, you know, sometimes a metal framework makes it so much stronger than a denture. And then this gets cemented permanently onto those implants, so it doesn't come in and out anymore. You're going to brush it, toothbrush, toothpaste, just like your regular teeth, and then you use a water pick just to kind of help keep it clean at the edge, but then you have absolutely nothing on the roof of your mouth anymore. You get to taste all your food. You don't have to worry about, you know, the thickness of a denture or anything gagging you.
All right, 571-5263, 571-5263. If you have any questions, are you a candidate? Do you have a loved one who may be a candidate, but you have a question for Dr. Ackerman? She's happy to field those now. I have a question for you here. So as compared to because we keep comparing them to the surgical implant, which is fair, the old method, are these as durable as a surgical implant?
Yes, yes. So I have patients that have had them for 10, 15 plus years. So they're made out of the same titanium. They're just a smaller diameter. So they're definitely just as durable as a surgical implant.
Okay, and foods that you formerly could not eat because your denture was flopping around, because you were afraid that they'd loosen. So you can do that now. These are solid.
Yes. Number one thing is steak. So many people ask me, so definitely can eat your steak again. A lot of my women patients want to eat their salads again, so you can definitely eat your salads again. You know, everything within reason, definitely it is there to eat all that good food.
Okay, so questions. We're open right now. 571-5263. Give us a call. Dr. Ackerman will field those calls. And we'll talk a little bit also about why she can do it so much. Why is it less invasive? Why is it so much easier? We'll show you another model, too. This is all very interesting. Give us a call. Once again, it's Freedom Mini Dental Implants. We'll be back after these. 571-5263 if you have any questions, but I'm going to go over a couple of things here real quickly with you, Dr. Ackerman. Okay, we talked about, or we actually saw Sean in the physical appearance, and there's a lot to be said for that, because it's not just how people, if they're impressed with you. I'm trying to think of a good way of putting this. You're impressed with you, the confidence, right?
Correct. Oh yeah, I've had so many patients, you know, come in and now they're able to go on job interviews and have that confidence and know that they can smile again. Some people come to me, you know, they had dentures made, they can't keep them in, they just gave up, they're not wearing them anymore, so they, you know, they don't go out of the house anymore, they don't want to go out to dinner with family, they don't want to go on a job interview. So this can be life-changing for sure. Confidence-wise, physical appearance, and just mentally, you know, mental health, and knowing that you've got that confidence in your smile and you don't have to worry about a floppy denture.
Yeah, you went into the right branch of dentistry because you're changing people's lives positive. It's not like a root canal.
Definitely.
This is good stuff.
Very rewarding.
I bet you get lots of hugs, flowers.
We do, yeah.
Oh, that's cool.
Actually, one of my favorite patients just brought in like pickled beets and stuff from her garden for us. That's one of my favorite things. So.
You better share those.
Yeah.
Okay, let's go to the phones. We asked for calls. Thank you so much for responding. Let's talk to Marcia, who called in. Marcia, welcome in.
Hey, how's it going?
Hi, Marcia.
Hi, Dr. Ackerman. I've been coming to you for years.
Okay.
I could not hold a denture in the bottom of my mouth, and I came to you, and you put in an implant in my bottom, and it's the best thing I've ever had done.
Well, there you go. What a great testimonial. That is awesome. Thank you, Marcia, so much for calling. And yeah.
I still come to you change my O-rings on the bottom.
You got it. She's doing everything we asked her to do. And what she's talking about is those little attachments wear out, and then it's easy, right, Marcia? You just come in, 10 minutes later, you walk out, and the denture's tight again. And it's, super easy maintenance. So.
I can eat steak. I can eat anything I choose. And corn on the cob even. They stay in my mouth, and it's the best thing I've ever done.
That's awesome.
Wow.
Yeah, how about that? We didn't even plan for that. Thank you, Marcia.
Unplanned.
Helping to spread the word. There's so many people out there that are struggling, and it takes a lot to make that phone call and come in.
Sure.
Some people are nervous about it or think it's too good to be true, and there's Marcia right there. She's lived it and knows that it can, change your life. And that's one thing too to mention, is that the consultation is free. It's no charge for the consultation. All you have to do is call. We'll take a 3D x-ray to make sure you're a candidate. I'm the only dentist there. We're small, family owned. We're not corporate. So you'll see me. We'll go over your options, go over cost. And like I said, the consultation's no charge. So, if it's something you struggle with and you're wondering about it, it's worth making the consultation.
Yeah, and Marcia, I can tell she looks 10 years younger. I can tell over the phone.
Yeah.
She looks fantastic. Okay, let's go to Joanne, who was nice enough to call. Joanne, welcome in, and thank you for watching.
Hello.
Yeah, Joanne, you have a question for the doctor?
I do.
Yes.
I have a denture in my upper, and it has that pad in the center, of course. And I was wondering, these aren't very old. They're kind of new. Can you cut out that and use those teeth for
Great question. So yes, so usually I don't want to make a promise I can't keep. Obviously you'd have to come to the consultation, but I have done it a lot for patients. As long as you like that denture, what I call the bite is good, the aesthetics are good, I have to just see it and make sure that it can be used. But a lot of times if you like everything about it, then yes, I can use that same denture. What we would do is, place the implants, and then the day I place the implants, I can trim, some of that roof of the mouth off for you on the palate area. So that's a great question. So a lot of times I can use the denture, especially like you said, if it's not very old, so it shouldn't be really worn or anything, and that would save you money as well.
There you go. Yeah. Thank you for the call. Appreciate that. Joanne, great question.
Yes.
Let's talk to Mary, who joins us now. Mary, thank you for calling. Welcome in.
Thank you for taking my call. My question is to the doctor. I have my own natural teeth. When I had my wisdom teeth removed, the doctor told me if I did that rather than have a root canal, that I would have lines from the corners of my mouth going down. And I just wonder if I was wondering if those implants in the back where those wisdom teeth were would help those lines to go away. Would those lines ever go away, or are they in too deeply?
So I definitely would have to see you for a consultation. It sounds like maybe because you're missing back teeth, and what he's talking about is your bite kind of collapses, so it kind of makes these lines right here. So there is a chance that, replacing those back missing teeth could, bring your bite back up, and you would, lose those lines. So it's definitely something to make the consultation and see if that would help. And it sounds like if you're missing those back teeth, that it may help to replace those and give you more to chew with as well.
Yeah, that's another added benefit. Yeah. Thank you for the call, Mary. Let's talk to Ron, who joins us now. Ron, welcome in. How are you, Ron?
Doing good. I've never met Dr. Ackerman. Dr. Stroud put in a lower plate with the implants, and I guess it's been 13 years ago. And I heard you say that the plate's starting to loosen up. I can come in and get the rubber put back in them, I guess, and tighten them up.
Yes.
And then I've lost 2 teeth, upper teeth. Is that something I can do at the same time, a consultation?
Yes, certainly. And we do, I'm glad you brought that up, because we've talked a lot about dentures and the whole mouth, but, I can replace a single tooth or 2 or 3 teeth with the mini implants. So yeah, definitely. All you need to call the office and tell them you need your O-rings replaced. That's those little rubber gaskets, and especially if you've had them for 13 years and haven't had them replaced, it will definitely tighten things up for you. That's an easy fix, and then we could do the consultation at the same time for you. So yeah, definitely give us a call. But this this is also kind of another testimonial. He's had his implants for 13 plus years, asking about durability, stability, so his implants are stable. It's just those little attachments do wear out over time, and that's an easy fix.
Yeah, and for those who are wondering, Dr. Stroud was with the practice, and now Dr. Ackerman took it over. Yeah. He retired very happy and made a lot of people happy, perfect smiles, and she's doing the same. So again, Freedom Mini Dental Implants. We're going to take more calls. We'll show you some other models here. And if you're missing one tooth, two teeth, maybe you have a bridge, we can help you there too, and we'll talk about that next on Wade Listens. Thank you very much, and I don't stress this enough. I appreciate everyone participating on this show. I mean, I really do. Thank you for watching, and thank you for believing in Dr. Ackerman and what she does, because it is, to me, it is life-changing. So let's talk about Freedom Mini Dental Implants. Let's go to the phones once again. Let's grab another quick one, and then we'll show you some models as promised. Brenda, welcome in. You have Dr. Ackerman.
Thank you. I have a question.
Yes.
Dr. Ackerman, do these implants, would these work for an older Down syndrome person?
Yeah, certainly. I've definitely done that before. As long as we can do the treatment, certainly. We've done snap-in dentures. We've done single teeth. So certainly there's no reason, the biggest thing is, as long as they can, tolerate the treatment, sit in the chair and things like that, there is no reason that they cannot have this procedure. 100%.
Thank you. Thank you for the call, Brenda. Yeah, and to be clear, you don't go under at all. It's just a little bit of Novocaine.
Right. Don't have to do sedation. So, if they've had a filling done before and done okay with that, then there's no reason they could not have a mini implant placed.
571-5263 if you have a question. While we're waiting for more calls here, if you would, show me. I mentioned this, and I like this model because it shows you how are you able to achieve what you do, because show them about the old surgical method, what they do.
Yeah, so you got to get pretty close to this one to see. But this just kind of shows the difference between the mini implant and the surgical implant. So the big hole that's easy to see, that is when they place a surgical implant, and usually they have to make an incision, flap the gum open, place the implant, and they have to have a lot more bone, as you can see. Now this little hole, that's the little pilot hole that I make when I place a mini implant. So that's why we say, you just have to have some bone, not a lot. So a lot of people that were told that they weren't candidates for the surgical implant, or maybe they had to have bone grafting or sinus lifts and it got really expensive, or you just didn't want to go through that that process, that you could be a candidate for the mini implant. So I just make that little pilot hole, and then it's it's just a smaller diameter titanium screw that kind of just screws and torques in, but no incisions and no stitches.
571-5263 for questions. Okay, for folks out there who say, okay, I'm missing a single tooth, maybe it was an accident, maybe it was genetic, whatever the case may be, or they have that flipper. You hear a lot about that. They want to get rid of that.
Flippers.
You can help.
Yes, 100%. We just did this for a patient this morning, actually. Actually, we did 3 single teeth, and she had a flipper in the front. So definitely got rid of that. So if you're missing just one tooth, like this tooth here in the front, we would place the implant. The day I place the implant, you'll leave with a temporary on there and get rid of the flipper that day. And then it just takes a couple weeks to get the nice pretty crown, the tooth made. And when you come back, obviously we'll try it in, make sure you're happy, make sure I'm happy, and then that gets cemented permanently onto that implant. So nothing comes in and out anymore. It's just like having a crown or a cap on a natural tooth. We're just doing it on an implant. Same thing, if you're missing multiple teeth next to each other, we can replace multiple teeth all at the same time. We do this a lot. A lot of people are missing their molars, your big chewers in the back. So we can place the implants and then have a bridge made that gets cemented on to those implants permanently. So if you have a flipper or a partial or that bulky appliance trying to replace those teeth, you get rid of that. And we always say, I had a patient say she felt like she grew her teeth back, and it's the kind of closest thing you can get to having your natural teeth back.
Of course, you are welcome to call, but if you're not comfortable with that, then of course you can have a free consultation. I want to stress that. So questions, 571-5263, but for a free consultation, what is involved in it? They come to the office, they want a consultation. How does that work, doctor?
Yep. So when they come to the office, first thing we'll do is we take it's called a cone beam. It's a 3D x-ray. It just confirms that you do have enough bone to, be a candidate for the mini implant. Then I'll come in and we'll talk about your, expectations, what you're wanting to accomplish. I'll go over your options. We'll go over cost. Like we said, the mini implant is usually about, a third to half the cost of the surgical implant. We do have financing plans if that's something you need to look at as well. We offer financing plans. So the consultation is usually about 30 minutes, and you send you home with all that information, and it's up to you to make an informed decision and make sure this is the right fit for you.
Yep, pre-consultation. Okay, more phone calls. 571-5263. Wylena joins us now. Wylena, welcome in.
Hi.
Hello.
I have dentures already, but when I was young, I had all my bottom teeth pulled, and I went without dentures for a while because I couldn't afford them. And then when I got ready to get them, they built my gums up. My gums fell. They built them up again, and they fell again. So then they took under my chin, they made an incision that put a bar and 2 screws up through my gums, and then a bar on top of my teeth. And now my bottom teeth are made to fit on the bar instead of the gum. They line up okay when you don't have them in your mouth, but whenever you put them in your mouth, they don't line up. There's space in the back.
Gotcha.
So I didn't know if there's anything to be done or not.
Yeah, it sounds like you went through quite the process there. Basically the best thing to do would be make the consultation, because I would need to see exactly what type of bar and maybe if they placed implants. Sounds like they did something, you didn't have a lot of bone there. But definitely I would make the consultation. Kind of hard for me to tell you over the phone if I can help you out or not without me seeing what's going on there.
Yeah, and the 3D X-ray is free too.
Right. Yeah.
Okay.
The consultation's no charge, so certainly, the best thing to do would be make the consultation with me.
All right, and thank you so much for the call.
Certainly.
I find it interesting that it was such a process, and we compared it before. We talked about cell phones and how they've evolved. And Dr. Stroud, when he would come on the show, he said it's a lot like when you have your appendix removed. Back in the old days, they had to cut you open. All this now it's done with a little bit of a laseroscopically, and this is a lot like that, isn't it? It's so much easier than people can imagine.
Minimally invasive version of dental implants, 100%, the laparoscopic version.
Yeah, and patient after patient. Now, before we leave today, I want to take one more look, if we can, at Sean, because when you see the before and after here, and you can have the teeth as wide as you like, but Sean looks like a happy guy. That's genuine.
Yes, very genuine. Yes, he's such a great guy, and he deserves that smile 100%. And now he doesn't have to, or like so many people, he was always worried about, obviously he had the missing teeth, and then, what tooth is going to break next, or he was just tired of trying to spend money saving his teeth, and he had tried everything. So now he's got the mini dental implants and the permanent teeth, and he can taste his food, eat, chew, and have that confident smile.
Yep. Sean deserves a great smile. You deserve a great smile, and you can have it at Freedom Mini Dental Implants. There's the number she mentioned. The consultation is free. Give them a call, and if you have a denture wear in your family, hey, let them know. Hey, it's a lot less expensive than you thought, less invasive. It's all good with Freedom Mini Dental Implants. All right, we're going to go